It's a quiet afternoon. Maybe you're sipping tea or reading a book. Suddenly you feel a strange heaviness in your chest, a wave of fatigue you can't explain. Or maybe your breathing feels off, not painful exactly, but just not right. Would you know what to do? Every year, thousands of older adults have heart attacks while alone. And many don't survive, not because help wasn't available, but because they didn't act fast enough, or didn't recognize the warning signs. Here's a sobering truth. 5% of heart attack deaths in seniors happen before they ever reach the hospital. But it doesn't have to be that way. Today you're going to learn 7 simple life-saving steps that anyone over 60 should know, especially if you live alone or spend long periods by yourself. These steps have already saved lives. They're based on real experiences, real patients, and the real mistakes people make when seconds matter. You don't need medical training. You just need the right knowledge and the courage to act. Because the moment you feel something's wrong might be the moment that changes everything. Let's begin. Tip 1. Recognize the warning signs. Most seniors miss. When we think of a heart attack, we picture someone grabbing their chest in pain and collapsing to the floor. But for seniors, the signs can be much more subtle and easier to miss. In fact, nearly 40% of seniors who suffer heart attacks never feel that classic crushing chest pain at all. Instead, they experience what doctors call atypical symptoms. But for older adults, these signs aren't unusual at all, they're just different, and recognizing them early could save your life. Here are the most common heart attack warning signs in people over 60. Unusual fatigue, not your regular tiredness. This feels heavy, draining, like walking across the room takes everything out of you. Shortness of breath even while doing simple things like walking to the mailbox or getting out of bed. Cold, clammy sweating even if you're not hot or active. Nausea or upper abdominal discomfort often mistaken for indigestion. Dizziness or confusion. This might be your brain not getting enough oxygen. Pain in the neck, jaw, back, or arms, not just the chest. Sleep disturbances or a sense of unease in the days leading up to the event. Let me tell you about Mrs. Jeanette, 82, a retired librarian. She never felt chest pain, but she felt lightheaded, mildly nauseous, and just off. She almost ignored it. Thankfully, her daughter insisted she go to the hospital, where doctors discovered she was having a heart attack. Trust your gut. If something feels wrong, don't wait, especially if you notice 2 or more of these symptoms at once. Don't downplay it. Don't chalk it up to aging. It's better to be wrong than too late. Tip 2. Call 911. Immediately, don't drive yourself. If you think you might be having a heart attack, call 911 right away. It sounds simple, but many older adults make a critical mistake. They try to drive themselves or wait to see if symptoms go away. That delay can be deadly. Here's why calling 911 is the smartest thing you can do. Every minute your heart doesn't get help, more heart muscle is damaged. After 10 minutes, the damage may become irreversible. After 30 minutes, it can be life-altering. And when you call 911, treatment starts immediately. Paramedics can give you oxygen medications, even defibrillation, all before you reach the hospital. They also notify the hospital in advance so the emergency team is ready the moment you arrive. Compare that to driving yourself, where you're not only alone, but your condition could worsen suddenly. If you lose consciousness behind the wheel, you're putting your life and others' lives at risk. Here's what to do if you're alone. Stop everything. Sit or lie in a supported position. Call 911 immediately. Unlock the door if you can. If you have a medical alert device, press it too. Call your family afterward, not before. Every moment matters. Tip 3. Take aspirin the right way. Aspirin can help during a heart attack, but only if you take it the right way. Aspirin works by slowing down blood clotting, which is critical because most heart attacks are caused by a clot-blocking blood flow to your heart. Here's what you need to do. First, call 911. Take 1 325 mg uncoated aspirin or 4 81 mg baby aspirins. Chew the aspirin, don't swallow it whole. Use just a small sip of water, only enough to help swallow. Tell the paramedics exactly what you took and when. Chewing helps aspirin enter your bloodstream 5 times faster than swallowing it whole. Do not take Tylenol, Advil, or ibuprofen. Only actual aspirin has the clot-busting effect. If your doctor has told you to avoid aspirin, skip this step and focus on calling 911 and positioning yourself properly. Keep aspirin in multiple places, your purse, kitchen, bedroom, and car, so you can grab it quickly. Tip number 4. Position yourself for survival. How you position your body during a heart attack can ease the strain on your heart and improve your chances. Here's what works. If you're short of breath, sit upright with your back supported and knees slightly bent. If you feel dizzy, lean back slightly about a 45-degree angle. If you're nauseated, sit upright and turn slightly to your left side. Loosen tight clothing, especially around your chest or waist. If you're cold or sweating, cover yourself with a light blanket to prevent shivering. Stay close to an unlocked door for easy access, and don't try to move to another room. Just stay where you are safe and supported. Tip number 5. Control your breathing with the 4-7-8 technique. Panic is common during a heart attack, and it makes everything worse, but with a simple breathing technique, you can slow your heart rate, reduce pain, and help your body stay calm. It's called the 4-7-8 method. Here's how. Sit comfortably. Place your tongue just behind your upper front teeth. Exhale completely through your mouth. Inhale quietly through your nose for 4 seconds. Hold your breath for 7 seconds. Exhale slowly through your mouth for 8 seconds. Repeat at least 4 times. This slows the nervous system and improves oxygen use. Studies show it can reduce anxiety and even lessen the perception of pain by up to 28%. Use it the moment you feel symptoms and continue until help arrives. Tip number 6. Self-compressions as a last resort. Let's be clear, you can't perform CPR on yourself. But if you're alone and start to lose consciousness, there is a last resort method that might help circulate a bit of blood. It's called modified self-compressions. Lie on a firm surface, not a couch or bed. Make a fist and place it in the center of your chest. Use your other hand to press down firmly, then release. Try to maintain a rhythm of 100 compressions per minute, the beat of staying alive. This is only for extreme emergencies and carries risks, especially for those with fragile bones. But if you're alone and fading fast, doing something may be better than nothing. Tip number 7. Create a heart attack action plan. The best time to prepare is now. Here's how to build your plan. Make a medical info card with your name, conditions, medications, and emergency contacts. Keep chewable aspirin in key spots, purse, car, nightstand, kitchen. Program ice contacts in your phone and set up medical ID access on your lock screen. Consider a medical alert device with fall detection. Make sure your house number is visible from the street. Practice the steps where you'll sit. How to call where the aspirin is. Talk to a loved one about your plan and arrange regular check-ins. Preparation gives you peace of mind and could save your life. Final story. Richard's quick thinking. Richard, age 72, felt off while gardening. Not pain, just strange fatigue and pressure in his back. But he remembered what we covered today. He stopped, called 911, chewed an aspirin, sat upright, and focused on his breathing. Paramedics arrived in 12 minutes. At the hospital, doctors found a 95% blockage in his heart. Because he acted fast, Richard made a full recovery. He told me I didn't feel panicked. I felt prepared. Now you are too. Recognize the signs. Call for help. Take aspirin. Position yourself wisely. Control your breathing. Know when to act. Have a plan. You don't have to be a doctor to save your own life, just aware, calm, and ready. Please share this with someone you love. You might just save their life.